What is the most watched sport within the United States? It is football. Despite being the most watched sport, the people watching overlook its lack of safety for the players' heads in favor of the entertainment that comes with it. I've spent thousands of hours studying, observing, and experiencing the game of football, which is why I feel qualified to discuss this major issue. It is important to inform people of this issue because it is valuable to learn about potential problems former or current football players can develop. To begin, I'll talk about concussions and how to identify them. The next topic will be long term effects these concussions can have, and finally, we can discuss what can be done. Concussions are often thought of as simple headaches that go away after 1 week. However, it is not so easy to diagnose. To even be able to diagnose someone, a doctor needs the recipient to answer questions. In football, it is hard to spot a concussion within the 22 players on the field. Players are also less likely to self-report because they would rather stay in the game no matter what it takes. And as you can see, when they join football around 12, tackle football around 12 years old, the rate of concussions increases by 2 times. And football has the highest concussion rate of any sport by at least 2. From my own experience, other things can cause headaches within football. Players can get headaches or migraines from the helmets they wear, and they could also get dehydrated, which can cause headaches. We are just learning what these concussions can do to people throughout their lives. Persistent concussions can cause other severe problems that can last for years. According to Cognitive Effects, one concussion can cause memory loss for years. It can affect a person's ability to work in a workplace environment or classroom because they are often suffering from a lack of memory. This can make it harder to test a person who has already had a concussion because their baseline is often lower than others who have not had a concussion. Research done by the American Association of Neurological Surgeons has found that some concussions can cause swelling in the brain. This lasts throughout the patient's life and leads to a higher chance of strokes or brain contusions. Repeated concussions have been linked to increased likelihood of someone developing chronic traumatic or CTE, in which you can see the difference between a normal brain and an advanced CTE, and also the most common type of injury within football is a head/face concussion. And as a football player has more cumulative force, the higher stage of CTE they will likely develop. While concussions and their effects are not entirely preventable, safety could still be improved for players. Football programs are constantly trying to improve ways to protect athletes' heads. The newest innovation to help reduce concussions is the Guardian cap, which is that thing right there on top of the helmet. The pads weigh about 1 pound in total and wrap around the athletes' helmets. CNN states that the Guardian caps can reduce severity of impacts by 5 to 14%, which you can see in the control versus the Guardian first generation and the Guardian, the most recent Guardian cap. Helmets are also being tested and upgraded every year. In 2021, the NFL says that their newest helmets designs reduce the impacts players receive in their heads by 7%, which is that helmet right there. Certain helmets are stopped from being used if they cannot pass a safety test, and these safety tests are done every single year. Concussions are more difficult to diagnose than what most people think. Concussions can total up, which can lead to an increase of strokes and other brain diseases. Football leagues around the country are trying to improve safety, but it may not be enough to protect the players. Football is an amazing sport to watch for its monstrous hits, but it's important to remember the cost that comes with it.